Good morning. This is the first of 3 lectures about pelvic disorders that occur in women's health. So we're going to start out with alterations of the pelvic floor itself because it causes a variety of problems. The uterus can prolapse, you can have a cystocele where the bladder falls, the rectocele where the rectum is pushing into the vagina, and then we can have an enterocele. So you can see the variety of types that we have. On the top left is the normal anatomy where the uterus, the bladder, and the rectum should be placed. If you look at the bottom left, we see a rectocele. And what happens here is the posterior vaginal wall is pushed forward because of this rectocele where the rectum is pushing through. There's not a big muscle layer or separation between the vagina and that rectal wall. The top right demonstrates the cystocele where the bladder is prolapsing forward. And then the bottom right is where the uterus prolapses. And I think I may have mentioned in a lecture in week 1 how I had the 80-year-old lady who came in to see me because when she sat down it was hurting. And when I went to do her exam, her uterus was halfway out of the vaginal introitus. So the signs and symptoms of pelvic organ prolapse depends on what the problem is. Is it the uterus, is it the rectum, or is it the bladder? But they all feel a sort of heaviness or fullness because something is not in the right place. There can be a bulge in the vagina that is felt by the hand or when sitting. So when they go to wipe themselves and they feel like, oh, what is this that I'm touching as I'm trying to wipe? This has never been here before. They can actually see or feel an organ as it protrudes all the way out of the vagina. And so this bladder, when it's full, puts so much pressure and then it extends out through the introitus. They can have a pulling or achy feeling in the lower abdomen or pelvis because everything is being stretched and pulled because of gravity. Some may have low back pain. Some are going to have urinary incontinence or problems having a stool, and they can't actually get the stool to come out through the anal sphincter because so much of it has protruded forward towards the vagina. So they have to place their hand by the introitus and maybe a little bit into the vagina to put pressure so that they can force the stool to come out through the anus. There can be some sexual difficulties because your organs are not in the right place. So when you try and have intercourse and, your bladder is sitting right there, well, the male has to negotiate past that, and there can be discomfort and difficulty. And the same thing will happen when they're trying to insert a tampon or if they're trying to insert an applicator to put estrogen cream in the vagina. And additional symptoms include pelvic pressure that worsens due to gravity when they're standing up. When they lift something, they can feel additional pressure, or when they cough. So the risk factors for developing any of these issues, of course, is age. But remember, age is a matter of mind. If you don't mind, it doesn't matter. But youth is definitely wasted on the young. If there's a history of pelvic surgery, that's a risk factor in and of itself because all of the pelvic structures or some of the pelvic structures may have been compromised, especially the muscular and ligament support. Going through menopause because we no longer have that estrogen to promote healthy tissue. Chronic constipation associated with straining is going to eventually weaken that the rectal wall and that posterior vaginal wall over time. Chronic coughing can do the same thing, but because of that valsalva, the uterus and the bladder are all pushed forward or down. And then obesity, especially truncal obesity, increases intra-abdominal pressure, thereby putting additional pressure onto the pelvic structures, and because of gravity, then these structures might fall. So this ends part 1 of pelvic disorders.